is important. If the only thing people can take away here is to just remember FAST.
Fast.
Okay, fast. If it is happening to somebody near you, if it is happening to somebody or even that individual, they need to call 999. And all you need to say is 999 is, I think somebody is having stroke. And they will be on their way. Or you tell them, I think somebody is having an heart attack. Even though the handler is still talking to you, they are discharging the ambulance straight. Because we know that time is of essence.
Hello everyone and welcome to Out of the Box. I'm your host Eunice Daniels, and today I've got with me my husband.
Hello, I'm Joe Daniels of Faith Chapel Network, and I'm glad to be on this show.
So we're going to be continuing with our program on health matters, and we've got two of our lovely friends. They are both GPs. We're going to be zooming in on the main health challenges that men and women face. We're just going to jump right in with Dr. Eno Oluwole. Can you tell us a little bit more about yourself so that our audience can know who you are and what you do?
Thank you so much for having me on this program. I'm really excited to be here. Thank you. So just like you've said, my name is Eno Oluwole and I'm a general practitioner. I work in the NHS in the UK. I'm also the founder of the Amazing Treasures Women Ministry here in Nottingham.
Thank you very much. We're glad to have you on our program. And we also have Dr. Femi Fenojo. Can you tell our audience a little bit more about you?
Oh, lovely. Thank you. Thank you for having me back again on the program today. Again, yes, my name is Femi Fenojo. I'm a GP. I work with NHS. I work here in Nottingham, here in the UK. And also, I'm the host of the YouTube Maranatha Teaching Channel.
And he's a musician.
Yeah.
You're welcome. So today we're just going to jump right in. Dr. Eno, do you want to go first with whichever topic you want to talk about?
Okay, I don't mind. So like I think in the previous episode we listed some of the chronic diseases, and we also highlighted the ones that are sort of relevant to the women or top on the list. We listed the five top killer diseases in women. And like I said in the previous program, in May 2021, ischemic heart disease was top on the list. So, and I would like to just talk a little bit about that. Although we know that the exact causes of heart disease or cardiovascular disease, as it's sometimes called, are very unclear, but there are a number of risk factors that can possibly increase our risk of getting a heart disease. And some of the risk factors include things like high blood pressure, smoking. I know this program is geared towards the Christian audience. I know most of us don't smoke, but
some do.
Perhaps
Some do.
well, perhaps we have somebody who smokes. So one of the common risk factors is smoking for heart disease, high cholesterol, diabetes, which I'm also going to talk about shortly, obesity or being overweight. Also, if you have a family history of heart condition, then you're probably more predisposed to having a heart condition as well. We also see it commonly in older people, so age is a factor. Also, unhealthy diet has been shown to be associated with your predisposition to developing a heart condition. And also, perhaps I could just mention here that the heart disease is typically caused by buildup of what we call plaques, which leads to narrowing of the artery and sort of cuts off the blood supply to the heart. And some of these common symptoms you might experience would include things like chest pains, shortness of breath. If you have any of those symptoms, chest pains, associated with shortness of breath, you need to call for an ambulance quickly.
Now, let me come from this angle. Over time, there have been little deposits of fat which changes nature and begin to deposit inside the blood vessels all around the body, and especially the heart. And that begins to cut short the blood supply to the heart. Whenever the blood supply is cut short, we have an area of the heart dying. And that is what is responsible for heart attack, because the heart doesn't then work the way it should. Okay, so we just need to get that little bit of information out there as far as the coronary heart diseases generally is concerned. And I suppose maybe if we talk about stroke, it will be similar thing happening, not in the heart this time, but in the brain. We'll move on to Dr. Feniger to talk a bit about another dimension of this.
Yes, I think, Dr. Eno has spoken about the heart issue. I think one of the topmost also cause of death in both gender that we talked about in previous episode is cancer. So I'm just going to touch a little bit on cancer because this is very...
Don't be frightened.
Well, in fact, the first thing I wanted to say is that the word cancer, if most people hear cancer, it strikes fear. Okay, and this is why this type of information is really very important. So we are not going to talk about every cancer, obviously, but we just want to touch on a couple of things that we need to be aware of. So once we talk about cancer, obviously we have to talk about cancer of various parts of the body. Okay, so there can be as many cancer as there are different parts in the body, but I'm not going to talk about everything, particularly with respect to men and also with respect to women. With respect to men, obviously we want to talk about prostate cancer. And on both sides, we want to talk about lung cancer and also the cancer that affects the intestine, what we call colorectal cancer. But I think generally, we need to talk about what are cancer. Okay. Essentially, cancer is when something is out of control. When a part of our body, the cell in a part of our body is out of control. And then it's beginning to divide and divide and divide and cause problem.
I call them cells behaving badly.
Badly, absolutely. I think I'm going to borrow that. I hope it's not
it's not
copyrighted. And really, that is it. Is cell out of control behaving badly. It's just like that noisy neighborhood that is causing trouble all over the place. And that is what's going on. But the most important thing is to be able, and this is really important, is for us to be able to know when should we be worried. Right. Because most of these cancer, once we can pick them up early, some of them we can do, in fact many of them we can do something about. And when we come about how to prevent some of these things, this is one of the reasons why we do regular screening. Right. For some of the organ in our body, even though we don't have screening for everything. But let's go back. So I think generally the first thing we will say is that definitely if somebody is losing weight without any cause, it's always good to check it out. Right. I mean, you are not intentionally wanting to lose weight. The weight is just dropping, you are still eating the same, you are exercising the same, weight is dropping. It's always a good thing to check that out. Right. Number two, if somebody is becoming unduly tired, and you cannot put a finger on, I mean, if you have run marathon, you should be tired. But if you can't put a finger on the reason why you are unduly tired, that individual needs to go and check it out with their doctors. Right. So those are the two things, talking generally, that I would say if any one of those two things happen, it's always a good thing to check it out. Now, the other thing I will talk about is bleeding. Now, that is specific, but oftentimes we don't cough out blood, pee out blood, stool blood. So apart from if somebody have an injury, if blood started coming out where it shouldn't come out, okay, coughing out blood, peeing blood, pooing blood, that is an indication that something needs to be checked. Okay, so that is just throwing it out generally there. Maybe we can talk about pain, but this will be specific pain. Okay, I'll probably say if you are having a pain that you cannot understand, that is persisting, that you cannot explain, it's probably a good idea to check that out also. But before I just round that up, I'll just mention one or two specific. Let's talk about that which is specific to us as men. Please, men, okay? Men, if you pass blood in your way, no matter how small, somebody need to check that out. And the other thing is that when you begin to get up at night to pass water more frequently than you used to,
Right.
or when you get there and the wee doesn't come on time,
Right.
or maybe at the end of it dribble. Now that does not necessarily mean it's cancer, because prostate can have benign problem.
Right.
But it's always good when you have those problems to go and check it out. Okay, particularly because I mentioned screening earlier on, particularly because we don't have a screening test for prostate cancer. So please, if you have any problem relating to passing water, please go and see your GP. All right. And I will just mention one or two more and then I will hand over. The other one is obviously the bowel cancer. Okay, I've talked about the general issue we need to be aware of. But again, the same thing, if you are passing blood in the stool, or if, and this is very important, if the way you pass motion changes, okay, and this is really important. Okay, again, it's not that you've eaten a lot of fruits and your stool becomes softer. I'm not talking about that. You normally open your bowel once every day, but suddenly you are opening it 2-3 times every day. It's becoming more sloppy than it used to be, particularly if this is persisting more than a few days. It is very, very important for somebody to check that out. I think I will leave it at that.
I think we need to talk about breast cancer
Yes.
too. You know, I think that's it's also a very common, you know, so who's going to take us on that?
Yeah.
Okay. Yes.
You know, the key things we need
Yeah.
the ladies out there to be aware of.
I kind of like the coordination.
You know, we need to be aware of, as ladies, what should they be, because, you know, in some parts of the world still, you have people coming in with what they call fungating, ulcerating breast cancer.
Yep.
And you will wonder, how in the world has it come to this? You know, and I think we just need to mention it, that people need to be aware of, so that it doesn't come to this before they seek help. And how is that possible?
Okay, so maybe first of all, I would like to say that breast cancer is the commonest cancer in women, and also is the second most common cause of death from cancer in the UK. So it's also a significant cause of morbidity. Breast cancer incidence is strongly related to age. So the older you are, the higher your risk of developing breast cancer. And so there's so many risk factors involved. If you have, of course, previous history of breast cancer, you're likely to develop breast cancer again. And like I've already said, the risk increases with age. Family history of breast cancer in first-degree relatives. There is also a genetic factor involved with breast cancer. And also, never having born a child also is associated. Say if you had your first child after the age of 30, then you're more likely to develop breast cancer compared to your counterpart who had a child below age 30, and also not having fed, and so many other risk factors. But back to the presentation, I think the commonest thing is which is quite simple as well, a breast lump. If you feel a lump in your breast,
That's right.
it is important that you see your GP immediately for further investigations. So that's the commonest presentation of breast cancer. We see women present with a breast lump. In some cases, just like you said, they've left it too late, and then it starts to fungate, which shouldn't really be. Other presentation could be perhaps nipple discharge, or nipple retraction, abnormality of the nipples. Some cases you may be able to feel a lump in your armpit, your axillary region. So, but like I said, the by far the commonest presentation is a breast lump, and I just want to employ all the women out there. If you feel a lump in your breast, you must see your GP. And also, I want to encourage that we do regular breast examination, because if you examine your breast from time to time, you'll be able to feel what is normal. So when there is a change, then you'll be able to pick that up very quickly.
When you say regular breast examination, is it every day, every week?
Well,
anytime.
As often as you want to do it. You can examine your breast as often as you want, and just to be aware of your breast, really, to know how it feels like.
To know what's normal.
So that, know what is normal. So that when it becomes abnormal, then you'll be able to detect that on time.
I like what Dr. Femi said. He said cancer cells are cells that are misbehaving and misbehaving badly. And when he said that, it kind of like simplified it for me. Because when, as Christians, because we're talking from the Christian perspective, we're letting people know what are the main killers, generally, in terms of our health. But from a Christian perspective, when something is misbehaving, we have something to call it back to. To be honest with you, that kind of like made it simple for me, So I think what Dr. also said, when you notice anything, talking about breast cancer, in fact, any disease, like you just mentioned, no need to fear. The Bible says that we should not fear. And and scholar says that God mentioned don't fear 365 times in the Bible. So if we actually notice anything, it's good to be calm. Go to our GP, let them carry out the investigation. At least we know what we're dealing with, And when you know what you're dealing with, you can attack it with the word of God and whatever else you need to attack it with, medication and whatever is prescribed to us. The secret is don't be afraid. It can be dealt with if we, take action immediately. Yeah.
So we talked about cancer. I suppose it's relevant because it's the second major killer across the board, male and female. Yeah. And I think from the female viewpoint, I might just say that if you have any irregular bleeding, especially if you stop your period, that is, you've gone into menopause for some like 6 months, if you bleed, go and have a chart. It may be perfectly all right, but also these are the ways sometimes cancers will be picked up, and endometrial cancer is cancer of the womb. They're very, very straightforward and easy to treat if they are picked up early. A lot of colorectal cancers too, or of the gut, or the colon, of the bowel, they are easy to treat if they are picked up early. So picking up early is a very important way of managing, and that's why we want to encourage you not to be afraid. Go and have a chat with your doctor. If I'm permitted to say, before you go to your pastor. Well, maybe we'll talk about that. We'll talk about that in the next program, because your pastor doesn't know what's going on. Or at least your pastor can pray for you, but at least you know he knows what he's praying for, he knows what he's believing for, and you know what you're dealing with. Praise the Lord.
Amen.
Hallelujah. I don't think we finished talking about this.
No.
So what else are we going to talk about? I think it was...
Yes, okay. So I just want to talk about type 2 diabetes because, of course, there are two types. Type 1, which occur in the early stages or a younger age group, and type 2, which is commonly seen from the age of 40. And this is usually associated with obesity. Yeah. So type 2 diabetes, we see it's just, in a nutshell, it's basically excess sugar in your bloodstream. And this is as a result of the fact that your body is not producing enough insulin, which is the hormone that drives the glucose from the bloodstream into the cells where it needs to be utilized. Or either your body is not producing enough or is not being properly utilized. And there's so many common symptoms. So before I say that, it's actually type 2 diabetes is about 5 times more common in South Asian and African Caribbean people. And the most common symptoms are feeling thirsty, wanting to drink plenty of fluids, passing loads of urine, and also feeling tired. Although tiredness is a broad symptom which you can have in almost any condition really, but it's one of the common symptoms in patients or in people with type 2 diabetes. Some people also develop blurred vision. They're more prone to developing infections like urinary tract infections and things like that. So what would be my advice, because it's so common, like I've already said, in South Asian and African Caribbean people, which is, again, like I've already said, is associated with obesity. If you find that for whatever reason you're just becoming very thirsty, you're drinking so much fluids, you're weeing a lot, or maybe you're prone to developing infections, then the alarm bell should be ringing and you should try and see your GP. But having said that, if the blood glucose is not too high, some people may not actually feel any symptom at the initial stage. And so that is why regular health checks come into place here. So sometimes type 2 diabetes is discovered when you see your GP for something else, and maybe they just tested your urine and found that there's glucose in the urine, and as a result, you go on to have some blood tests done, which confirms it. So in addition to maybe perhaps if you're having symptoms, if you don't have symptoms, like I've said, every opportunity you have to see your GP, you should take that opportunity just in case.
So how easy is it to, someone's having blurred vision, how easy is it to go to the GP and actually get the GP to carry out the test?
Okay, so again, blurring of the vision is not the top symptoms that people present with, although you can have that as some of the presentation. Again, blurred vision is quite broad. It could just be an eye problem. So in which case, if your issue is just blurring of the vision, to start off with, I would perhaps advise that you see an optician to have an eye test done, and also get them to look at the back of your eyes and just to check properly. Yes.
It's just to help clarify, because sometimes.
Yeah, I think moving on, Dr. Fernando, you said you were going to talk about stroke.
Yes, I think that is really an important one for us to talk about. And I think when we're talking about heart attack, we kind of started talking about it because the process is almost the same. I always look at heart attack and stroke as demand and supply type of thing. So we have this organ, this marvelous, fantastic organ that God has given us, our brain. Just like the heart, everything, trillions and trillions of, connection and nerves in that brain. But that brains need food, need oxygen, and that is being carried to it by the blood. So anything that stops it, either slows it down or stops it suddenly, will cause exactly what happened to the heart, will cause it in the brain, and that is what we call stroke, essentially. But the most important thing that I want people to take away, and you will have had this on the screen, the word fast. We all are fasting as Christians. So F-A-S-T, and this is very, very important. And I think if people would take that away, that is very, very important. So the word F is when the face is drooling. Okay, so somebody with, and there are various reasons why the face can drool, but when we have all these three things, because the last one is actually what you need to do, essentially. So when one side of the face is drooling, suddenly, it's not there before, you don't have any reason for it, that should actually raise an alarm, and that is very important. The second one is when there's weakness of the arm or the leg, okay? Even if the weakness is not too bad, especially when you have all these three symptoms, because the third one is slurring of speech. So F-A-S, but the last one is T, which is time. Because heart attack and stroke need time. The outcome of heart attack and the outcome of stroke depends on the speed with which we are able to get that individual help. And this is why it is important. If the only thing people can take away here is to just remember F-A-S-T.
Fast.
Okay, fast. If it is happening to somebody near you, if it is happening to somebody or even that individual, they need to call 999. And all you need to say is 999 is, I think somebody is having stroke. And they will be on their way. Or you tell them, I think somebody is having an heart attack. Even though the handler is still talking to you, they are discharging the ambulance straight. Because we know that time is of essence. Okay? The only other thing I would just say before I round up is that a whole lot of these things that we have talked about, all this lifestyle actually feed into them. Okay? And I'm not going to go through all that. It's just that a whole lot of what we do and what we don't do actually feed into the risk factor that can eventually lead to people having this type of diseases. But just be aware that time is essential. Okay, once you know what to look for and those things are happening, please get help and get it quick.
Yeah. And even if you live in some parts of the world where you don't have 999, whatever you do, don't try and deal with it and pray first, okay? Pray as you go.
Pray as you go, yes. Pray as you go. I think I'm picking up a lot of things here. Pray as you go.
But get that person to the best doctor in your area as soon as you can. And I believe God is helping different parts of the world where they too can, get help very quickly. And I think there's one more thing that we said we're going to talk about, which is what most people don't talk about, and that is dementia or Alzheimer's disease. Same family.
Yes, I think that is definitely something that is worth talking about, particularly because it does not only affect the person that suffers with it, it is the stress and the strain that it causes even on the family. And when somebody you know, when somebody you love, your mom, your dad, your spouse, just seems to disappear in front of you. And I think this is why this is important, particularly because there are factors that we can actually modify that can help. So now again, dementia is the blanket title. Now within that blanket title there are different dementia, but we don't need to go into all that. But again, dementia is essentially a disease of the elderly. I think the one thing people need to be very, very look out for is when somebody begins to forget. And the forgetfulness tends to be the things that just happen. We call it short-term forgetfulness.
Right.
A lot of these people can remember where they went to spend their holiday 10 years ago, 20 years ago, but they cannot remember what they have for food in the morning.
Right.
Okay, and that is very, very important. But, and this is very important, oftentimes these elderly people usually find a way to cover these up. So, I mean, most people will not come to you and say, I'm getting forgetful. But when they begin to ask you the same question over and over again, then you need to start paying close attention. Or when they, I mean, all of us forget things. Or when they cannot remember things that you think they should remember. Okay, you are driving out, they forget where your popular restaurant is. They start getting lost. I mean, obviously, as this progresses, you know, the symptoms start becoming quite visible. But oftentimes, the people that are close to them will begin to feel that something is not quite right. Okay, mommy, daddy, my spouse seems to forget things. It doesn't. You know, they don't know where they left their key. And by the way, we are not talking about those common, I don't know where I left my key. But you know, the worrying things. They go into the kitchen, they forget, what am I here for? So those symptoms and the fact that they are persistent. And obviously, it can then progress to other areas where it affects their behavior, where it affects, sometimes even the way they work, the way they move. But at the beginning, those are the things we need to be aware of. And obviously, there are some disease processes that also predispose people to having dementia. For example, a type of dementia tend to happen to other people that have had stroke.
Right.
And this is why when somebody is having stroke, it's better to treat it early. So there are so many other things that feed into it, but those are the takeaway that I want people to be aware of. If you are seeing those things in yourself or in people close to you, get help. They can be assessed, they can be investigated, and there's help.
Wow. There's so much we could talk about, isn't it? You know, I think information is out there. Certainly information is out there. You will see what we're trying to do in this program is just to talk about the key things that you need to take home with, not because we're expecting you to have a particular problem or disease, but because we want you to know in case something close by or mirroring the symptoms of any of what we said happens, you know what to do. You know what to do. And by the grace of God, you act quickly and that issue can be sorted or at least begin to address this condition.
And you know, the Bible also says that my people perish for lack of knowledge. So there's nothing wrong in having knowledge.
Actually, perish could mean die.
Absolutely.
My people die because they lack knowledge.
Having the information and what to do, what causes it, arms us with the necessary ammunition we need to deal with it. So look forward to the next episode, because we're going to delve into how to treat these things, how to manage them.
Praise the Lord. And now, until we come across your path again, remain blessed and remember
that you can do all things through Christ
that gives you strength.